am Stephanie Wolff, PA and CEO of the Novus Center. Today we have Julia coming in for a CELLUWave treatment for the Cellulite protocol. So we are using acoustic wave therapy for the treatment of cellulite. And what that actually does, just so you understand, acoustic wave therapy is using sound wave technology. And what sound wave does is it goes in and creates a little micro trauma. So it's going into the skin, the tissue, and it sends this signal to the brain that says, hey, there's been a little bit of trauma here. I need you to start sending in some growth factors, some stem cells, some healing properties, so that we can start to repair this damaged tissue. Now, when we talk about cellulite, let's just, lay it out on the table real quick. So what you have is you've got this top layer of the skin, and from that, underneath there, you've got your adipose cells or your fat cells. Underneath the adipose cell is going to be your muscle layer. So what connects the top portion of the skin to the muscle layer are these fibrous bands. And these fibrous bands over time can become just very dense, tight, constricted, or maybe the fat cells have expanded so much so that they're actually bulging out into the skin, which creates that dimpling that you see. So it's a combination of two things. It's going to be the pooling of the fibrous bands, but it's also going to be the herniation of the fat cells. And why this happens usually could just be genetics. It can be hormones, history of pregnancy, weight gain, weight loss. So a bunch of different reasons why. 80% of women over the age of 20 suffer from cellulite. So here we are, right? What we do now is when I'm doing the treatment for cellulite using the acoustic wave therapy, it's basically going in and it's going to create new tissue formation. It's going to help break up any tightening of the fibrous bands and then also help reduce the cell size of the adipocytes. So it's basically flushing out these fat cells, creating more blood flow, and then creating more tissue. So it sounds like a lot is going on, which is why I'll typically tell patients you need anywhere from 10 to 12 treatments. There are clinical studies using acoustic wave therapy for the treatment of cellulite, and we do have those on our website if you're interested in those. Typically what I'll do is I'll bring patients in and I'll always take photos before each treatment. Number one, because it's kind of hard for you to see what's going on in the back if we're treating the back of your thighs. But two, it kind of gives us an idea of where you're going as far as how many treatments you need. For the most part, what I'll say is patients need about 10 to 12 treatments. And I'll do approximately 2 treatments a week, again, just depending on the patient, how they're feeling. There really is no bruising. I've never had a patient bruise. There could be a little bit of discomfort the very first treatment just because it's new to you. You don't really know what's going on or what to expect. But for the most part, patients come in and, like Julia here, she calls it a massage. We will be sending you home with a dry brush. I do believe in dry brushes because it's basically promoting lymph drainage and blood flow. So it's like your homework at home. I also use a cellulite cream, and that we can talk about when you're here. Some patients choose to do it, some patients don't. What the cellulite cream does is it actually helps to break down the fat cells. So I always like to kind of think about it like if you've ever heard of a fat burning shot or lipotropic shot, it's like that, but in a cream form. And so it's something that you guys do every single day. It's once a day that you'll apply the cream. So let's get started, and that way you can see how it looks.
So we start with a little bit of ultrasound jelly because this helps with the conduction of the sound wave. So basically what I'm doing is I'm going along in a snake-like pattern over the tissue. It's all about releasing the fibrous cords. We're going to promote blood vessel formation. We're going to tell your body to send in fibroblasts, stem cells, healing properties, so that you can really start to heal that tissue. Again, we're helping with the lymph drainage so that we can start to shrink those fat cells. The whole procedure, if I'm doing both legs, takes about 30 minutes, so approximately 15 minutes per side. Like I was saying before, You know, Julia eats healthy, she exercises every day, she drinks plenty of water, her hormones are regulated because she sees me for hormones, but yet she's still stuck with that nagging cellulite. And again, that's because of genetics. That's number one, you guys. And like I said before, 80% of women over the age of 20 suffer from cellulite. So you can do everything that you can, but it doesn't mean you're not going to have cellulite. It's not your fault. And that's why we're here. So you'll notice that she's just a little pink, but nothing that's going to cause any kind of bruising. So just to recap, we're using acoustic wave technology. Acoustic wave administers a sound wave. And that sound wave, think of it as a cavitation or a little water droplet underneath the cellular level. And that water droplet or cavitation sends a signal to the brain saying, hey, there's been some micro damage from trauma. I need you to send some fibroblasts in. I need growth factors, stem cells, healing properties, all to come down to this tissue and start to repair the tissue. So if you think about it, as we age, we get thinner skin. We're losing that connective tissue, that collagen that makes our skin nice and fluffy. And if you think about cellulite, you basically have this top layer, and underneath that top layer of skin is going to be fat cells. Fat cells are then connected via these fibrous bands from the top layer to the muscle layer. And so the more fat cells that you have, the more they're going to herniate and bulge up into the skin. And that's when you're going to see these little pockets. But at the same time, they're also pulling on the fibrous cords and basically tethering them, creating that dimpling. So with the sound wave, we're going in and we're promoting blood flow by a process called angiogenesis, which is the creation of new blood vessel formation. And what that's going to do is it's going to help with the adipose cells or the fat cells with drainage so that you're shrinking the fat cells, but also promoting new tissue formation. It's also going to release the fibrous bands so they're not as tight and taut, perhaps from scar tissue, so that they can relax just a little bit more. And that's really the whole process behind acoustic wave therapy for cellulite treatment. I always tell my patients when they're doing this process of blood flow and tissue formation, it can take anywhere from 4 to 6 weeks to start to see that change. So if you're doing 2 treatments a week for 4 weeks, that's 8 treatments. And that's really when we start to see the change in our patients. 8 to 10 to 12, just depending on how much cellulite that patient has. Now, some patients will say, well, what's the maintenance look like? And every patient is different. So if we get to 10 or 12 treatments and you're satisfied with how things are going, then I would say at least try to do this once a month. Obviously, smoking and diabetes is going to make this more difficult for you because those 2 things restrict blood vessel formation and blood flow. So now you're not feeding that tissue, you're actually damaging that tissue. It's not painful and it won't cause bruising. I had one patient ask if you already have varicose veins or spider veins, will it make them worse? No, absolutely not. Remember, we're creating new blood vessels and feeding the tissue. So you're getting nice new skin again. So as you can tell from Julia's treatment, there is no bruising, there's no redness. It looks like nothing happened, and she's quite comfortable. She's actually shopping on Amazon right now. So definitely something that you can do in your lunch break or after work or before work, and just go about your normal life. So again, there's no downtime, there's no pain. I'm not injecting, I'm not sending you home with pills. It's all natural. So, what better way than using an all natural approach to helping your cellulite treatment?